is Cavallo Christie, and I'm currently the Public Policy and Organizing Specialist here in Rhode Island for Planned Parenthood of Southern New England. And I'm testifying in support of S678, the Rhode Island Doula Reimbursement Act. So more women in America are dying of pregnancy-related complications than any other developed country. The problem is on the rise. According to the CDC, in the United States, maternal mortality rates increased by almost 27% between 2000 and 2014. Of the 4 million Americans who give birth each year, 50,000 suffer severe injuries and 700 die. Data from the Rhode Island Department of Health shows that in Rhode Island, the maternal mortality rate between 2013 to 2017 was 11.2% per 100,000 live births. The data also shows there has been an increase in severe maternal morbidity rates, particularly among Black women, and that's 306 per 10,000, compared to white women, which is 179.4 per 10,000. The fact is, among Black women, maternal mortality and morbidity is a crisis. Nationally, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. Black women in the United States suffer life-threatening pregnancy complications twice as often as their white counterparts. This severe racial disparity cuts across income and education levels, socioeconomic status, and physical health conditions. Simply put, a Black woman is more likely to die or suffer severe harm while pregnant because of the color of her skin. The Black maternal mortality crisis is a symptom of the pervasive racism and unequal treatment built into our healthcare system. Because of racial disparity in healthcare access and quality, Black women are more likely to suffer from medical conditions that lead to pregnancy complications. For example, high blood pressure and cardiovascular disease, preeclampsia. In the delivery room, Black women often felt devalued, disrespected, and their concerns dismissed by medical providers. And there are so many stories out there with so many examples, for example, in NPR and ProRepublica. And what we also know is that stress from racism and racial discrimination has adverse effects on the health of Black women. So receiving support and care from a perinatal doula during pregnancy, labor, and into the postpartum period has shown to increase positive outcomes. For example, data from a University of Minnesota School of Public Health study shows that women of color who receive doula support have lower preterm and C-section birth rates. And according to the Rhode Island Department of Health, between 2002 and 2013, the rate of C-section births in Rhode Island increased from 26.3% to 31.7%. Additionally, other studies have found that states could reduce their rate of C-sections for Medicaid births to 22.3% by offering doula services to Medicaid recipients. And a quarter of the states who do this could save over $2.5 million annually. For example, in 2010, the state of Wisconsin could have saved over $28 million if every low-risk birth had been attended in hospital by a professional doula. So the data is clear. However, many women are unable to take advantage of doula services during pregnancy because they are not covered by Medicaid or private insurance and cannot afford to pay out of pocket. In addition, many doulas are unable to provide care to pregnant women because they cannot be reimbursed through Medicaid or private insurance. Bill 678 will provide a definition of perinatal doulas and the services they provide in Rhode Island. The bill will make doulas eligible for coverage under Medicaid as well as private insurance and reimburse doulas for the care they give. So Planned Parenthood of Southern New England and the Coalition for Reproductive Freedom believe that carrying a pregnancy to term should not put women's lives at risk. Maternal mortality and morbidity in the United States is a public health crisis, and its severe impact on Black women is simply unacceptable. access to reproductive health care, including culturally competent perinatal and postpartum care, is an essential human right. PPSNE also believes that healthcare providers, including doulas, deserve fair compensation for the work they provide. Doula care increases positive outcomes during pregnancy, and doula services must be covered under public and private insurance. So other states like Oregon, Minnesota, and just earlier this week, Indiana have expanded Medicaid to cover doula services, while New York has launched a pilot program. So we urge you, or Rhode Island state senators, to support Bill S678 and put it to the full floor for a vote. Thank you.